Unfortunately, in this society, when you turn the TV on, all you see is everything that's bad for you. And then you see commercials of drugs to fix it, drugs to fix it.
Feeling healthier and doing some things to take care of my well-being. Why did I have to wait until something was threatening my existence for me to react?
Greetings, this is Dr. Triple O. I do have some distinguished folks next to me here today, and they were here during the last episode, and they're going to be talking about mastering your health, specifically wellness for men. Why men? Well, we do know men tend to die younger than women, or they die at younger age than women, and they tend to seek medical care less than women. And so we're going to talk about the obstacles or the reasons why this is the case. And it will be interesting to hear from a female perspective, because usually when these men are married or have a girlfriend, what role does women play in that dynamics? And these men have families, they have wives and children. Do they understand those behavior or the lack of engagement in healthcare, what that will do to the family if something should happen to them? So this is what we're going to talk about. So this is going to be free for all. So we're going to start with Wayne. So what's your perspective on men's health? When you hear men's health, what does that mean to you?
Well, there's a certain irony to that, because I am in healthcare. I run a surgery center with 45 other surgeons and have been engaged for the last 30 plus years in medical care. And I have to say that I am a victim of the very same thing that you're talking about with respect to taking care of one's health. I do see younger people who are coming in with more severe disease, mainly because there is no taking care of themselves earlier or diagnosing earlier. I mean, today's technology has really advanced itself. You can diagnose things much sooner than before, which is why they talk about cancer or colon screening, getting checkups. The earlier that you can have intervention, the more likely that if a problem is discovered, that you're able to resolve it quicker, sooner, with less impact upon your own health, and as you mentioned, your own family, because I've seen a lot of families have come through where they have to take care of their mother, their father, or their sibling, and the toll that it takes, not just financially, but the emotional toll is significant with respect to prolonged illness because of a lack of care. So the emotional toll, that does lead into the financial aspect of it, but we're seeing more and more younger people that's coming in with that. And I think a lot of that probably is because of the fads that we have, the fast foods that we have, the eating differences, more away from the natural products, of course. My parents, although they were more natural products, they ate a lot of fried foods. So let's say for my own education, my father, he worked for a meat packing plant. He had processed meats, processed bologna, salami, that sort of stuff. If anyone remembers Crisco in the old days that came in a can, right, that you kind of like scooped out that little white gook and you put it in the frying pan and you made that fried chicken, or God forbid, we used to travel on long trips from New York to South Carolina, and my mother would make a bag of sandwiches with the fried chicken and the bread in it, and then you had the biscuits and everything. Where nowadays we know that's not all exactly healthy for you. And what a lot of people don't know is that some of that food, it changes as you cook it. So let's say bacon or anything else, or fried bologna that they used to have, once you put that in the frying pan with the lard, it changes from nitrates to nitrites, I think it is, which is a cancer causing. And more we discover that there are things out there that we eat or do to ourselves can cause further illnesses. So it's really important, as you mentioned, Dr. Triple O, to have that early diagnosis, to get that regular family checkup. even not just with the family checkup of our bodies, our teeth can tell us a lot about ourselves. Dental care, caries, bad breath, that's all an indication of something that's going on within your body. But the only way that you're going to be able to find that out is through early diagnosis and intervention that's there. Now, I have said earlier, I am a victim of that. I am due for my colonoscopy. I have had a colonoscopy before. There was no issues whatsoever. You don't really remember anything because you're taking what's called propofol. So you're having anesthesia. You don't feel anything whatsoever. And yes, my male doctors, I've had those, have gone where no other man has gone before. So yeah, it just takes a little bit of pride to say that there's really not much to it. It's a very quick exam in the doctor's office.
Let me ask you a question. So what was the problem? What were you scared of? I mean, why were you so fearful in going for your initial colonoscopy?
You know, it's that manhood thing I think gets in the way. I'm a guy, and it could be anyone for sure, but if you've ever been to the doctor's office and you had a digital exam, in case those of you out there who don't know what a digital exam is, they check your prostate through an opening in your rear. And I was trying to keep it clean as much as I can.
Yeah.
And they check your prostate, and then there's that they give you a tissue to wipe yourself afterwards. It's kind of like, oh God, I've just been violated, but it's not really like that at all. It's he's there for a purpose to discover things earlier, and I think what has just held me back is just the idea of going through the exam and getting it done. And probe. But God, I can say to you, there's so many lives that are saved from people, and I see it every day because in my field, we do a lot of GI, a lot of colonoscopies, endoscopies, and there are polyps that are discovered early that's sent out for testing, whether it's cancerous or not. It could be considered what's called benign, non-cancerous. But that early discovery makes a difference between whether you have to resection your colon, whether or not you get a colostomy bag put inside of you, and just be able to discover that cancer early enough that the treatment is easier than what the treatment would be later in life. And it does become life-altering for you or your family and your loved ones who care about you. And I've seen the emotional tolls that it has taken on some families when you got to take care of someone that's sick, and you realize in yourself what number of years you may have left when you can have so many more years added just through prevention.
So, Ricky, do you think this has to do with ego or the lack of maybe some of these men seeing their parents undergoing this preventive testing?
I think some of it is cultural. And by the way you were raised and what you've seen in your family. And the unfortunate thing is, and I can speak for myself, I think that I don't practice what I preach when it comes on to wellness. I don't. And I heard Wayne speak to the colonoscopy. I just had one on Tuesday, and that really happened because of my wife scheduling it. If she did not, I would be probably doing the same thing I did in 2023, 2022, and 2021. But here's the ironic thing about this whole piece when I think of wellness. And just sitting here is some form of guilt for me because you understand it because that's your background, that's your expertise. You know, we say the same terminology over and over again. Prevention is better than the cure. That's been around from when I was a kid. If I would only follow that definition, I would be trying to do some things. I mean, I think I treat my cars better than I treat my body. You know, some of us, and I don't know how you all do this, but, my cars are washed once a week. They're tuned up when they need to be tuned up. They are serviced when they should. And everything gets done. And I'm spending a lot of money on it, much more than I would be spending on some procedures on myself. But I think in order for me to live the life that I need to live, to be around for my family, I need to pay much more attention to this. And you heard me say when I said about the guilt, me coming into your wellness center here today, actually is some guilt on me. So at least I started doing some things, and by realizing how simple the colonoscopy was, the only true challenge I had was that I didn't eat the day before, and I was very, very hungry. Mm-hmm. And I got to feed this big structure. I got to. That has to be done. But I just think that we just need to look at life a little bit different. And we need to pay more attention to, some of us have used up a certain percentage of our runway based on our age. If we want to enjoy more of the runway, we have to do some preventive stuff. We have to make sure we, your center is named, that we need to make sure we're well. And I like wellness, because we got to put those two pieces together and really do it and not be a hypocrite to what we're doing. And you heard me say earlier, I said, practice what we preach.
Yeah, absolutely. So Lisa, as a female, in a family structure, when you see your husband not, seeking those preventive measures, understanding the impact in some family members where the husband may be the breadwinner, and the wife may not be working, may just be taking care of the kids at home. So if something should happen to that husband or the man, all of a sudden now the spouse, the kids don't have that emotional, financial support that they need to move on. How do you or your friends deal with your spouses in terms of getting them, or at least encourage them to do what they're supposed to do?
Good old guilt. For me, I work. I'm busy as my husband, but I think that a lot of time. My dad, by the way, died at 53 from pancreatic cancer. He was very young, so I lost my dad my last year of law school, also when I was pregnant. But I think for men, they view themselves as manly. That they have a shift. They need to make that shift in their minds in terms of like, this is not a manly thing to do, to go to the doctor, to check up on myself, and it's really not important in their mind to do these things. So I try to encourage my husband to to try to take care of himself, and to try to make it a priority. He doesn't always think it's a priority to take care of himself, and I just try to work with him to try to make that shift. But it's hard. To Ricky's point, there's some cultural things in terms of how we eat. How my husband eats, how we eat as a family. It's always a battle in terms of he'll go out and bring home food, and it's not the food that I necessarily want us to eat or the kids to eat. And so he was raised a particular way. He sees at providing food as being the provider for the family. So he sees food as a reward, meaning that he sees that, when he comes home and he brings home the bad food, he sees that as being manly, like I'm taking care of the family and I'm feeding them. But from his perspective, he's doing what the man is supposed to do. So
that raises an interesting question. So I'm thinking along the different terms that maybe what you might be saying also is that as a provider, you're kind of in control.
Yeah.
You're kind of controlling your environment that's around you.
Yeah.
But when you go to a doctor or you go for an exam, you just don't know what the outcome is going to be until you get the results. And then there's a sense of loss of control at that point because your fate is in the hands of something else.
Right.
And then when you finally get that done, are you back in control again? Or it's just I think it's kind of maybe just a fear of I'm no longer if something was to happen to me, I'm no longer the provider. If I discover something, I can no longer contribute. So as long as I don't pay attention to it, I don't know, I know it's kind of wild, but perhaps it's because of being that role model in the family that maybe we're afraid that we no longer can be that if something was to happen to us, which is really kind of dumb actually, because the whole idea between prevention, as you mentioned, or getting tested
Yeah.
is to help us prolong that life so we can
I
be
think,
defended.
I think, like to Ricky's point, like the men just kind of see themselves as providers. What do providers do? They go out, they work, they bring in money. They, it's like that old school. Like you go out, you hunt, you bring home the meat. That's what we do. And it's just like for him, he didn't want to do his colonoscopy because it wasn't
I gotta ask you a question. You're a professional female.
Yeah.
You're a lawyer.
I do the same
Would you
thing.
take care of yourself?
I do the same thing, which is.
So that's an interesting trend.
Yeah.
So as men and women work together, they have work jobs together. They
Yeah.
both bring in two incomes, or they have a career together. Are we finding now that females who are now into that workforce, are they emulating what the man would
I
be
just
by
did that
prolonging
this
not
week.
their preventive care?
I had a doctor's appointment. I'd not been to the doctor probably in over a year, and I got a meeting thrown on my calendar, and I had to go to the meeting, and I canceled my doctor's appointment. I haven't rescheduled it yet. So I think that it's now, could I have made it a priority? I could have. I could have said I'm not going to the meeting. I have a doctor's appointment. But I think that it's about, I guess, maybe what I viewed as my priority. But it's and the same thing for a man. It's like their priority is to be a provider. Their priority is to go to work and bring home the bacon. And you probably see going to colonoscopy as an inconvenience. Taking time out of your day, you gotta fast for 24 hours. You gotta be there for a couple hours to do the procedure. That's time you could be making money.
So it's amazing you said that, because I think we have to break this down sometime and realize the influence society has on us.
Right.
And then the fact that we have allowed society to make us behave differently. I keep hearing that everybody's more health conscious. People are eating healthier. We hear that over and over again. We hear that certain workspaces, they are talking about wellness, and just the whole piece that what does health and wellness do to productivity? But what we lose sight of is there's individuals that, and I can speak for myself. I fear doing the colonoscopy because I just don't like going to the doctor. I view it, I'm an optimist, I'm positive, I'm confident. When I go to the doctor, I become a different individual. Mm-hmm. Because it's historic, it's cultural. And after I got the results from the colonoscopy, I felt like a champion. What I was fearing was that I created so much fear for this procedure when it was so simple and so easy. Now, I have a different mindset. Now I want to do more preventive stuff because it's not as difficult as I built it up to be. Mm-hmm. And I think it's mind over matter. Okay, and and to be honest with you, I want to live a very, very healthy life, and I want to live as long as I can live. And now that I've gone through this first procedure, and it's ironic because I pay attention to what's going on around me. I've had some friends that have gone through some difficult times recently with prostate cancer issues. One had an issue with his colon, and every single thing that's in my space has influenced me. So I went and got my, what's that? It's the
PSA.
The PSA done. After a good friend of mine had his prostate taken out. He's actually younger than me. And the cancer actually spread. Mm. So Ricky went into fast forward, man. I was on a hustle. Mm-hmm. When I got my results, I felt relieved. But I'll guarantee you this much, I'm going to have it checked as often as I can have it checked. And the same thing with a colonoscopy. I'm going to go back in 3 years because they found some polyps. But I think that we have to stop fearing prevention. Mm-hmm. And we have to start acting on prevention. And stop lying to ourselves. Stop preaching one thing and doing something else. And, my wife was happier than me. My kids, I mean, I was getting all these text messages on my way in. Daddy, I love you. Everything will be well. I mean, and I realized, I knew before, but getting those text messages made me really think about it and say, I really got to be healthy for my family. I really need, because if I'm not, there's going to be nobody for them to send those messages to.
And that's a great point. I think that's one of the things that most men don't realize. Those messages received. Imagine for weeks and months and years, your family have been worrying about you not doing those things. And they're worried about what could happen if you eventually do go, or what could happen if you didn't go at all. So they're afraid. They've been afraid. Now there's a sense of relief on their part that, oh my God, my husband, my dad actually went through this. Everything is fine. Whew, we don't have to worry anymore.
And Doc, I've been on a mission since July of 2022. July the 25th, to be more exact. My A1C was whacked on a doctor's visit. And the doctor said to me, he says, Ricky, you really need to go and see your cardiologist. I went into a panic mode. I was afraid. I sat in the parking lot for 34 minutes because I know it. I kept track of it. I called my wife and I said, I got to do something different. So, I work with this president of a university that I saw a shift in her weight. I asked her, who you working with? What have you done? I called that dietitian instantly. And I said, I want to talk to you. Within a week, I was on the program. And feeling healthier and doing some things to take care of my well-being. Why did I have to wait until something was threatening my existence for me to react? I'm a smart man. I'm viewed to be a successful man. But look at those behaviors. I am not going to relive that again. I don't want to be down that cycle. So I'm going to continue to do the things that are going to make me feel better, make me live longer, and make me feel like I'm well.
Right. And to piggyback on what Ricky is saying, to do the things that make you feel well and be better. And we were talking about prevention or getting your annual checkup up, how often you want to get your checkup by your doctor. Even with a more of a personal relationship, it was through going to see my primary care doctor that through my testing, I felt a lack of energy. And this is more on a positive note. Had I not gone to the primary care doctor, I would not have found out that I had a low testosterone level because I didn't feel the energy. I was kind of wanting to sleep most of the time. Your whole life balance is thrown off. You don't want to necessarily go for walks, go for bicycles. And I said, that's not me. I want to get back to those years when I was a teenager. Well, I know I'm never going to get back to being the years of a teenager.
It's a good goal, though.
But it's a damn good goal. And back in my 20s, when you wanted to go running, you want to hang out all night and all of that. And yeah, sure, you got married, you got family and everything, but still, I wanted that energy. And there was no reason why I couldn't have that energy again, or that lust for life and to do things. And through the checkup, by having a testosterone level check, I found out I had low testosterone. And then I went on testosterone treatment. I tried different things. The lotions didn't work as well, and I didn't want to do injections, but then there's a thing called pellets, and I tried that. So I gave it a try. It's once every 6 months or so that's not a big deal, once every 6 months. But in return, I run faster, I walk faster, I have lots of more energy. I'm more engaged now than before, want to travel. Life has taken on a whole different meaning for me because of that one little change that I discovered that I had a hormone imbalance. And that applies to women as well. So here I am. I'm not going to say my age, but I can run. I heard someone, I think that's my wife in the background, just laugh. I won't even
No, she smiled because
So
what
this-
she was saying was that she's so happy that you made that change because she
that energy.
wanted the energy from her husband.
Yeah, and she got it. So anyway, we'll keep going with the energy level of it. Just going for that annual physical, discovered something that was so easily treatable and made a life change and such a major difference in what my whole outlook is now on enjoying this hard work that we've done, the opportunity to go out there and just do more. It makes you want to exercise, and it's just like I said, just go for that one little primary care treatment, get your blood work done, not a big deal, and it can be a big game changer for something that's just so small. Whether it's something as simple as testosterone level or something simple as getting a cardiac checkup or getting a colonoscopy, it's minor considered to the benefits that you're going to actually get out of that.
Great. I think Lisa said something a few minutes ago. I want to kind of go back to. I think you asked a question. Even though this is about men's health, and we were trying to figure out why men don't go for preventive care. But it's interesting that you asked the question: does this have to do with being a provider? And I think being in a society where the person that provides is always hustling to always do that. Now the same thing applies for women. So when we look at women who are coming to the office for routine checkup, tends to be stay-home mom who have with kids. But for the professionals, yes, they prioritize their profession, like their career, over their health, and that goes for both men and women.
Yeah.
Wow.
So I always tell people, look, your body is like a temple. Think you spend more time on your car. I do the same thing. You take your car for service like you're supposed to on a routine basis. There are some people who don't do that. They wait till they hear a sound and you drive your car to the shop, and the guy goes, well, you have a flat tire, your engine oil is low, you have this, all of a sudden you have so many issues with your car.
Good point.
So there are people who are afraid to go to the doctor. They've never gone to the doctor for preventive stuff. Now they're thinking, if I go, they're going to find so many things.
Yeah.
They don't want to go.
And for professional women, it could be even worse because we're juggling so much, I mean, I'll make my kids' doctor's appointments. I'll make sure they get to the appointment, and but I'm not making my own appointment, or not consistently going on an annual basis to make sure I get all my checks done. And I mean, and I can relate. It's like you're waiting till, I feel a pain, or you feel threatened by something that you make it a priority to go to the doctor. So I mean, I think that across the board, professionals just at times just don't make it a priority to go do the annual check, to put it routinely on your calendar, to go get checked. I mean, I know I'm not doing it, and really, prevention is really what you should be pursuing. I mean, I totally agree with that.
I mentioned in another episode that I had over 30 years of experience in healthcare, and I've seen some things today that still existed way back then. Is that a lot of people tend not to go to their primary doctor, but tend to use the emergency department as their primary doctor or means of getting medical care. And by that time, as you described a little while ago, that if you wait too long, things begin to accumulate. That is wrong. You gave the example of the car. If you don't, your oil's low, your tire pressure, transmission, and then by the time you get one thing fixed, there's 10 other things. The emergency department is not the place for you to get your care done. Primary care is for emergencies. And yes, to today, we still have a lot of people who still use the emergency department as their primary doctor. And the problem with that, the big problem with that, there's no history. So if you have someone who's been taking care of you for years, they can see the changes in you. There's a documented record of that. But if you just jump from one location to another, there's no tracking of your health. And therefore, there's no pattern that's there that can be seen that can be prevented by you just having one person that you go to and maintain a medical record with that.
I think all these points are great. A few things I need to kind of touch upon again. If you don't have a primary care doctor, go get one. If you do have one, I haven't been to one in a long time, please make that phone call tomorrow, make your appointment, and see your primary care doctor. Prevention is better than cure. The number one cause of death in adults in this country is cardiovascular disease, heart disease. And this can be prevented by living well. Living well means exercise, eat properly. As a professional, we are all guilty of this. We put our job, our career as priority, and we care for our kids. And when we make appointments for them, we'll make sure everything is good for them. But if we die, if we're not here, then they don't have anybody to look up to. They don't have anyone to support them. So we have to be healthy to take care of those the family members. So make yourself priority. You know, it's like a pregnant woman. If that pregnant woman doesn't survive, the baby cannot survive.
Right.
So it starts with you as an individual. So those preventive things are not scary. It's more scary if you have a disseminated disease, cancer that's spread to your lungs. Behind heart disease is cancer, as you know, the leading cause of death in this country. Number two, and when you think about cigarette smoking, there was a study looking at, or CDC report looking at the incidence of smoking amongst women, different socioeconomic class, and marital status. It was very interesting because people who have no high school education smoke more than people who have high school degree, and those people who have high school degree smoke more than people who have undergraduate degree, and people who have undergraduate degree smokes less than people who have graduate degree, and people who are single smoke more than people who are married. So there are different things you can look at, and then you look at minority groups. The blacks and Hispanic tend to smoke. Well, they smoke about the same, but there are certain factors that lead to cardiovascular disease, heart disease, and cancer. We can prevent a lot of this, and it's something that we just have to educate ourselves about. Unfortunately, in this society, when you turn the TV on, all you see is everything that's bad for you, and then you see commercials of drugs to fix it, drugs to fix it. We spend less time on showing commercials, on showing information on how to prevent stuff.
Right.
These are preventive stuff you need to do. The most industries don't make money on preventive stuff.
No.
So it's more on the drugs. You get this, we can fix it. You get erectile dysfunction, we can give you this. You have heart disease, can give you this. You have diabetes, can give you this. How about changing your way of life so you get off of the medication? So I think the goal for today's topic is really to shed some light into why we're not doing what we're supposed to do, and hopefully you can go back and sit down with your family and just have a discussion, an open discussion of, hey, how do you think I'm doing? What are the things I should be doing? What are you concerned about me not doing what I'm supposed to do? It's okay. I mean, being a man doesn't mean, you let your ego get in the way. Ego will not save you from having cancer or heart disease. So get yourself checked. Thank you all for being here today. Lisa, you've been a pleasure having you here.
Thanks for having me.
Ricky, as always, very spontaneous. Have a lot of advice. Wayne, always a pleasure.
fun. Yeah.
Funny. I love all those insights. I hope you all enjoy this show, and I hope you took something away from this show. And until next time, stay safe. Do those preventive measures. Prevention is better than cure.